And God said, let there be light. And there was light. God saw that the light was good, and he separated the light from the darkness. And now, here's Reverend Sue.
Got joy in my soul. God is in control. I got Satan on my trail, but I'm singing all is well. He's attacking every day, but I'm watching while I pray. No matter the attack, I won't turn back.
Good evening, and thank you for joining us again this evening. And you know what? I know I tell you I'm excited every time that we actually come online, but my level of excitement is going up every single day. And this weekend, I am really excited to have Mark T. Hatchard. And you know, he is a Prince George's County. And Prince George's County is located right outside of Washington, D.C. And he is from Prince George's County. And he, you know, the thing about him is that I don't know where to start because he's such a genius. You know, I'm not saying I guess him not being genius, but he is a genius. I'm telling you, he is definitely a genius. And he studied physiology and psychology and music at the University of Maryland in College Park. He is currently the president for the fraternity here in Washington, D.C. area, and a member of two bands that have toured nationally on multiple occasions. He's a scientist. He's an educator, composer, musician, who is currently completing his doctorate in physiology and biophysics at Howard University. And Howard University, I told you he's a genius. So thank you for taking the time to be with us today. I want to call you doctor, but I don't want to offend you because
not quite yet. Almost there.
Not quite yet. So you're also very involved with fraternity. What fraternity are you involved with?
It's Iota Phi Theta fraternity, incorporated their national, international social service fraternity. Okay,
and you actually a native of Prince George's County?
Yes, ma'am. Largo, Maryland.
In Largo, Maryland.
Born on Andrews Air Force Base. Yes, ma'am.
Oh, so military.
Yes, ma'am.
And you graduated from actually high school where?
At Bishop McNamara High School in Forestville, Maryland.
And that's right also outside of Washington, D.C.
Yes, ma'am. Right outside.
Right. So, you know what I want to do, because so many people talking about the virus.
Right.
And I want to have a conversation with you. You know how you sit down and talk to your relatives because they know you're a scientist and they come and ask you all the questions.
And you know, I welcome that. I send an email and say, hey, if you have any questions, this is where you come. This is right. If the purpose of a PhD is if I don't know it, I know where to find it out. Right. That's a PhD.
Right. So that's the type of conversation I want to have.
Yes, ma'am.
Have with you is that the virus is here.
It
seems like to me, for us, for how I look at it, it's going to stay here for a while.
Mm-hmm. Mm-hmm.
People are still suffering. You know, the hospitals, people suffering the lack of jobs.
Yes.
People are suffering in the standpoint because some people fear the virus, although some have taken the vaccination, both,
yes.
And they're still nervous about going out, especially our elders going outside. So right. That's a lot. Tell me, I guess I'm going up like with this.
Okay.
How do you feel about people who are actually not vaccinated?
Okay, so this is I think all the questions around the vaccine and the virus are loaded, mm-hmm. But everyone has their reasons for not being vaccinated. Mm-hmm. And most of the time, a lot of those reasons are misinformed. And I will say not wrong because, you know, if you have everybody has their own life, they have their own circumstances. So I'm not going to sit there and tell somebody that you're wrong, you're incorrect. But a lot of times, if you're making the decision if you're physically able to get the vaccine and you don't want to, for whatever reason, it's usually because you've been misinformed. You've been told that it's going to make you sick, which if it does, it is no worse than the flu or than a day-long flu or muscle ache. Nothing like the hospital stay or potential death that coronavirus will provide for you. I will say that if you are physically able, and you're not immunosuppressed, if you are able to get the vaccine, get it. It is saving lives. It is this thing is real. This virus is real, and it's out here and it's killing people. And we want to not just save your life, but think about your uncle's life, your grandmother's life, your children's lives. Mm-hmm. It's not just about you. It's about everybody, your community around you.
Mm-hmm. When you say if you're able to get it, meaning what? Meaning that?
Well, right now, I believe it's over 15, and I think the studies are coming in I think it's over 12, actually. It's 12 and over, and the studies are coming in from the 6 to 12 range saying that it is safe for 6 to 12-year-olds, but the FDA hasn't approved that yet. If you are not immunocompromised, meaning that and this is a very small proportion of people, you'll know who you are if you are. And you will have a doctor that told you are immunocompromised. We aren't very trusting of this, but that is a very, very minute portion of the population. And if it's unavailable to you, those are the 3 reasons why you wouldn't be able to get it. But I believe it's universally available now. You can go down to your local CVS and get it. It's very safe. It's very effective. But other than those 3 things, and one of those is about to fall off, the 6 to 12-year-olds, it is available to you, and you should get the vaccine.
Mm-hmm. So my great-great-grandmother told me that the story about Tuskegee.
Yes, ma'am.
Then when I got older, I read about Tuskegee.
Yes, ma'am.
And now the virus is coming here, the vaccination is coming. No. I am not taking it. I don't trust people. I don't trust politicians. I'm not doing it. How will you address that particular statement from
that is
one of your relatives?
The reason why I became a scientist is because of that attitude, because I don't trust it. That is science. Science is, I don't trust it, prove it. Science isn't just a body of facts or a bunch of people in white coats telling you what is and isn't. Science is something that everybody on the planet should be doing for themselves. It is saying, I don't trust it, prove it. Now, the second step in science is that a lot of people don't take after the Tuskegee experiments, and they quote all these wonderful historical things. The second step is now you got to go research. Now you have to go and figure out how people have proved it, how people have proven how it is effective. I just want to back up very, very briefly and talk about like how science works. It is not, like I said, it's not a body of facts. It is a bunch of people trying to prove each other wrong. And when you can't be proven wrong, when you say, hey, no one has been able to prove me wrong yet, that is when we exercise a level of confidence in certain things. And the vaccine that we have here has a very high level of confidence, even though we have an entire planet out here of scientists trying to prove it wrong. It is held up against every test it has been put up to so far. So I'm very agreeing with those people that quote Tuskegee and quote the way that the science industry has treated Black people, Black Americans specifically in the past. But now we have Black people working in these spaces, making sure that it's safe for our community.
Mm-hmm, mm-hmm. How has, and I agree with you, I've always really loved scientists because I kind of understand, you're out there, you're proven this is what's happening. And sometimes it takes years to do it, many years. But so how has how has politics affected the mask, no mask, vaccinate, or do not vaccinate?
Well, the politics and I will say some bad actor politicians, I'm not going to name any names, but you can probably point to a couple, have co-opted the space of people who want to believe in them, who want to believe something, who need a leader, who need a a direction to be pointed in. And they have taken this and used it for their own ill-gotten goods, unfortunately, and told people, well, I will get more people on my team, more people to vote for me if I create this us versus them dynamic. It is very self-serving and is very detrimental to not only the political landscape, but also to the healthcare landscape. They're splitting people up and saying, well, I'm going to go get vaccinated, but I'm going to tell you guys not to get vaccinated or not to wear a mask or not to do this, that, or the other, because I want you to feel like I'm giving you information that nobody else will give you, so you'll vote for me again, when it's absolutely false. And that is that second step in criticism and saying, well, I don't believe you, but now let me go see if what you're saying is right. What kind of backup do you have? And a lot of people have stopped short in that step, which is why we find this split in politics, why we're starting to, the voter suppression that we've seen come out in the recent year. I believe it's something like 19 states have passed very restrictive voter suppression laws, and it's piggybacking off.
States passed 30 this year.
Yes, ma'am.
30.
And it's piggybacking off of this idea last year that somehow we got too many people to vote and the virus was scaring people. And it's we understand how easy it should be to vote now, how readily everybody should be able to vote. You should have a ballot sent to your house so you could send it back. You should be able to drop off your ballot anywhere over the next 3 weeks. You shouldn't just have a Tuesday, a working day Tuesday between the hours of 8 and 8 to be able to vote. Now they're using the excuse of, well, the virus scared everybody and we're making it too easy. And now there are illegal votes. There are no illegal votes. There is no voter fraud going, or minuscule as to not matter any voting fraud. And they're using this virus, this very serious issue, to pull more votes in for themselves, and it's honestly despicable.
When I think about what you're saying from a political perspective, when people tell you that bleach is good to drink for the vaccination, I mean, and you follow that or you think about it, 2 seconds you think about it, you shouldn't think about it at all. So it's been really heavy from a political standpoint, and some people believe what some politicians say. And so I think that's one of the reasons why. And it's also power to the point that I'm going to prove to my people who support me that, this is not real. It's not the virus. You don't have to take your vaccination. And that is really, really, really bad. I also think that people do have a choice, but now it seems like people are not they become very narrow because some companies are saying, if you don't do the vaccination, we're definitely not going to continue to employ you.
And this is an issue we're running into at Howard University now with people that do not want to get vaccinated. And like I said, I understand their concerns. I understand the issues around the things that you've been hearing coming from certain circles, from certain social media outlets, even from certain contemporary media outlets. But what I like to say is that there are very, very trustworthy sources out there, and trustworthy sources that have been challenged over and over again by other people, by other companies, by organizations, and their work holds up. And that all of that work says that these vaccines are safe. These vaccines are going to save lives. And these vaccines are better for the economy, better for your economy. Because if you get sick, nobody's not going to go to the hospital when you get sick. Nobody's not going to have to pay those hospital bills when you get sick. Nobody's going to keep paying you your hourly paycheck when you get sick. These have very real consequences or if you get somebody else sick in your house, they have those consequences to worry about as well. So I understand people's trepidation toward the issue of workplaces forcing you, but you should consider it a public act of decency, not they're making me do something I don't want to do. You're doing something for your community around you and for yourself.
I like what you said about there's a reason why you became a scientist, and I like that. I have some friends that they became just medical, not just but medical doctors, and if you really talk to them, sometimes it's a reason why someone in the family has some type of disease and they couldn't be healed. It was like a personal thing. Yes, that they became doctors because they wanted to help, they wanted to do better, they wanted to improve what was really happening. So I admire you for saying I became a scientist, not because you read about it, you became a scientist for a reason.
It's funny. Sometimes I say I didn't as much become a scientist as realize that I was one. I just realized that's who I am. That's who I was. That's who I always was. And, every little child that is growing up that is exploring their world and jumping in puddles and knocking things off tables, they're explorers, they're scientists. They're experimenting with their world every day. And that's something that I hope we all embrace at some point, at one level or another.
Mm-hmm. Now, is this the first pandemic?
No, this is, there's quite a long list of pandemics. In fact, one of the first pandemics that we recorded is the bubonic plague, which, interesting, people use the term plague and pandemic interchangeably, but that's not quite correct. Plague refers specifically to that Yersinia pestis microbe that was passed from rodents to fleas to people back in the 1500s. But we've had since then the smallpox pandemic, we've had the cholera pandemic, we've had the Spanish flu, which again, wrongly named. It started in Kansas. It had nothing to do with Spain or Spanish people, all the way up to HIV/AIDS, which we're still struggling with. SARS, which was a precursor to this current virus. It was another type of coronavirus. And as people will see, like this current one is called SARS-CoV-1, right? Because it is coronavirus type 1 discovered in 2019, but is of the SARS type. So we have a long history of dealing with these things, and not just pandemics in general, but even coronaviruses. We've been dealing with coronaviruses for years.
Mm-hmm. And the Spanish flu, the virus was in 1918 or something?
1918, yes, ma'am.
1918. I asked that because some people think that this is the first, but it's not the first here in this country.
And in fact, if we want to go back to politically, there were political mandates around wearing masks and washing your hands. And unfortunately, they didn't have the vaccine technology that we did then, but there were mandates that were passed down from the government. This isn't the first time. And most of the country, because we didn't have those political actors that were seeking to take advantage of people, most of the country said, hey, of course, why wouldn't we want to keep people healthy? Of course, why won't I want my neighbor to stay safe? It wasn't an idea until, like I said, bad actors put that idea in our heads, and we've got to get rid of them.
And I was thinking for over 50 years, children could not attend school.
Right.
Until they receive their vaccination.
Right. Exactly. This is nothing new.
Measles, polio, all those, yes.
MMR, measles, mumps, rubella, polio vaccine, diphtheria, tetanus. I have to take a tetanus shot every time, every 10 years or so, to stay involved in the program, academic programs. This is not new.
Mm-hmm, mm-hmm. So, in your opinion, how? Let's see. Now, vaccinations are a problem.
Mm-hmm.
Question mark.
Mm-hmm.
Your opinion?
So, there's a lot of vaccinations are one of the biggest, the most helpful things that we've introduced to this world in the last 100 years. We have saved millions, and billions of lives with vaccinations. Now, I know we don't have time for that, but there's a lot of arguments as to why it might be people, and you would have to break down whether some people say, well, we just developed this thing so fast, I don't want to inject the thing in my body. Now, we've been working on this since the 80s. The first paper that I've seen that's speaking about specifically the the Pfizer, Moderna, mRNA vaccines, they started working on this in 1989 and have been updating it slowly since. There was a Polish woman named Katalin Kariko, who has been working in this since the mid 80s on introducing vaccine-like things, cancer or therapies via mRNA vaccine into our bodies for at least 30 years. This is not new. We're just tailoring it, and every vaccine works the same. We sort of tweak the things that we have years and years of data on. We just sort of tweak it for this particular issue. That's how your flu vaccine works every year. We have different types of flus that pop up every year, and we just tweak it to sort of try to catch the one that's most prevalent this year.
I'm thinking about nutrition. And does nutrition play a role?
Absolutely. Your nutritional intake and your diet, your level of exercise absolutely play a role, not just in specifically coronavirus issues, but just in disease susceptibility in general. So if please, reduce the sugar intake, please reduce there's so many things that have a ton of salt in them. Please reduce your fast food usage. I know that we're dealing with a lot of food issues and food deserts, but there are companies and there are organizations that are working to get good food out to people. But please be aware of the soda you drink, the cheese and the bread that you intake, and your physical activity. You should be getting at least 30 minutes of physical, of not strenuous, but physical activity a day. Even if that's just a walk around, your neighborhood, because we know that you are more predisposed to complications if you are obese, if you have certain levels of enzymes in your body. I hear a lot of people that complain about the masks and say they can't breathe in these masks. Well, if you cannot breathe in your mask, you are probably of an elevated risk because you might be having pulmonary issues. And we know that this thing attacks your lungs and attacks your pulmonary system. So if you're having issues breathing behind the mask, that might be a precursor for you being a part of the elevated risk category.
That's interesting, because I hear people all the time say, I have a problem breathing when I have the mask on. I start coughing when the mask is on.
You must consider that if you are having that problem, because like I say, if I'm on campus or if, teaching in class, whatever, that mask is on me all day, no matter what. And at some point, you just have to forget it's there. And if you cannot forget it's there, if that's laboring your breathing so much, then you may be at higher risk for hospitalization and unfortunately death if you cannot breathe with your mask on. So you more than anybody should be wearing. I know it's uncomfortable. I know it's tough. I know you may need to go outside and take breaks every now and again, but that's even more reason to get vaccinated, because there are less times that you have to be wearing a mask. If you're vaccinated around other vaccinated people, even indoors, which we're going to be doing as the weather turns colder, you don't have to wear your mask as much. So if you don't like wearing the mask, get vaccinated.
Has there been a decrease in flu cases since masking and vaccinating?
And fascinatingly, yes, there has. We have seen a small decrease in influenza, and most of that is because it doesn't have the chance to transmit. We've been staying away from each other. We've been staying off of out of crowded spaces in general. But the issue, the difference between the decrease in flu and the prevalence of coronavirus is that the coronavirus is much more infective. It is much easier for coronavirus to infect you than an influenza virus. So although we see decreases in influenza, that doesn't mean we need to take our foot off the gas pedal. We need to keep taking the precautions, washing our hands, masking up, making sure we're avoiding the 4 C's. That's close. Don't be close. Don't be in enclosed spaces. there continuously and don't be crowded. So close, continuous, and crowded. Avoid those four. And continue to do that while we're dealing with this coronavirus pandemic. But first off, get vaccinated, because even though we're seeing decreases in flu, we're seeing increases in variants of the coronavirus. So, and these things are much more infected than the original. So we have to make sure that we're staying on top of this.
What can we do? I guess in going through another pandemic. We're going through this now, but what can we do as a population, as people?
I think the best thing that we can do right now is to be informed and understand how to get good information, what sources to get good information from. I think this is what's killing us right now, is that there are so many bad sources of information. And again, I'm speaking of people sharing links on Facebook, politicians that don't know what they're talking about, certain news networks that don't know what they're talking about or have insidious agendas. Become your own advocate, become a critical thinker, make sure, but take that step 2. Like I said, step 1 is I don't believe it. Step 2 is, where do I find the information that I can trust, that is been vetted? This is the most important thing I think that we can do to prevent future pandemics. And if we can't prevent it, at least we will minimize its detrimental effects.
And that's why I started out the conversation when I said, you're sitting around with your loved ones and family, and they can ask you all these questions as a scientist. People you love very much, and you're not going to miseducate them at all. And you're not going to do that anyway, but it's people trust you and you trust them. Right. And I think that's very critical, to get good information. That's why I was excited for you to come on as this young scientist and very sincere about what you're doing and where you're taking it.
Oh, I sincerely appreciate that. Thank you.
That's really exciting to me about that. And as also, you're also a teacher at Howard University.
Yes. Just, a couple courses here and there. Yes, ma'am.
But you're doing that.
Yes, ma'am. Yes,
ma'am. I want to ask you a couple more questions.
Absolutely. Okay, I'm having a great time.
You're a musician, right?
Yes, ma'am.
You're a musician and you're a scientist.
Yes,
scientist, musician. As a musician, you're creative. You create it. The sounds come from the universe, and you just have it like it's like a library in your brain that you come up with all these notes and everything. How do you see the similarity between the scientist and the musician?
Oh, it stark to me. The thing that I like to say is that art is the science of connection and community, and science is the art of observation and inquisition, and masters bridge the two. So as an artist, as a musician, I have to learn to take the elements that I've, the scales that I've learned, the chords that I've learned, the theory that I've learned, and apply them to a current situation and be able to improvise. And this is, a lot of life is improvisation. Do I have the tools to do it? And do I have the what's the word I want to use? The creativity, I guess. Not the creativity. Do I have the confidence to trust myself in improvising in this situation, be it in the lab, and ask myself new questions and say, you know what? Nobody's done this before. Let's see what I can figure out. Let's use this technique that I learned over here, and use this certain sample, and use these animal models, and throw them together and see what I get. Or be it in life, if I'm in a situation that I've not been in before, the creativity aspect is something that we're all capable of. It's not unique to musicians or the creatives. It's something that we should all use, and it's instrumental, excuse the pun, instrumental to a good scientist. Both each other has to talk to each other. The scientist in me and the artist in me have to inform each other. So that's, yeah,
I see that. I mean, I'm not a scientist or not a musician, but I can see the two definitely together as comparable.
Yeah. Oh, you're a scientist. You're an absolute scientist. Now, don't let anybody tell you that you're not out here making observations and asking questions. You know, you absolutely are. You're part of the club.
Part of the club.
Yes, ma'am.
Right. Perhaps I can enroll in one of your classes.
I would love to have you. Would love to have you.
I thank you so much.
Oh no!
I want to call you. I want to call you doctor. I can call you doctor on this show if I want to.
It's your show.
That's right.
I appreciate the compliment.
Dr. Mark D. Hatcher, thank you so much for taking the time to be with us today. And that's one more question.
Oh, yes, ma'am.
I do have a team, so the team is, hey, wait a moment. Okay. Where do you see yourself going forward years from now?
Oh, that's a great question. I love teaching. I love research, but I think my heart, like my passion really relies, and this is indicative of being on your show today, is in the public understanding of the sciences. It's science communication. It is science and policy. It is making sure that we are bringing the things that we learn in the ivory tower to our communities, specifically the underserved and underrepresented people in the sciences. So I see myself hopefully being a beacon for folks to be able to look up and say, hey, or being part of the dais of folks that you're able to turn to and say, all right, I don't understand this. What does this mean? This is what scientists, we should be doing. We should be communicating with everyone, with our communities, and saying, all right, if you don't understand it, let me break it down. Let me give you a good resource for how you can understand this as well as I do.
Scientist, educator, composer, musician, doctor. I can say doctor. Dr. Mark D. Hatcher, thank you so much for taking the time to be with us today.
Thank you so much. I'm honored to be on your show today.
We have to have you back real soon. We got
anytime. Just let me know and I'm there. Anytime.
We need people like you to continue to educate us in a just a totally different environment, a totally different way.
Yes, ma'am.
You're not CDC.
Right.
You are a scientist, and you're becoming that great scientist that you have always wanted to be when you was a little boy, running around the woods or probably outdoors doing things. And we thank you so much for taking the time to be with us.
And we thank you for you doing your wonderful, wonderful work. We need you and we appreciate you. Thank you so much.
Thank you. You've been listening to Sunday Evening with Reverend Sue, and we just love you. Continue to follow us, be with us, Facebook, YouTube. And let's remember that it's left up to us to get the right information and be educated. It's not time not to be educated now. To be educated what's really happening that totally concern us. May God bless you.
And it's building my testimony. So glad I made it. Is there anybody in here have that testimony? I made it through. I made it through. In spite of the storm. In spite of the storm and rain. Heartache and pain. I'm still alive.